Hi, everybody. It's Dr. Laura with Connect My Brain. So glad that we are connecting once again, talking about the various things that go on with our children and what can we do about it. And more importantly, how does it impact them? And little things like the primitive reflexes have such a far reaching impact on the development of a child. And when we look at a child through a developmental assessment, we're primarily looking through the window of five different categories: gross motor, big movements; fine motor, like handwriting; social, communication; and then adaptation. And I'm always highlighting adaptation because it's a big one. And I'm always trying to help parents understand that a child does not have a point of reference to necessarily come and tell you, hey, I'm having trouble reading because my balance is off. And when my balance is off, it affects my eyes. Did you know that if your balance was off, it would affect your eyes and how your eyes work? And if your eyes aren't working right, how math might be hard? Looking at columns and trying to follow the steps. Reading might be difficult because your eyes may be jumping all over the place. Why is this? So, lots of times when we're working with kids, especially from the academic arena, our initial steps are tutors. And while tutors are great, so even though we might talk about a particular area, it's never to judge, it's never to tell you don't go to a tutor or anything like that. But the point is that if you're going in trying to work on the higher brain function without fixing the bottom, the lower part of the brain, the child will always be tripped up. You can kind of think about it. If I wanted to lose weight and I ate really well 1 or 2 days, but the other 5 or 6 days I'm in fast food or not even paying attention, I wouldn't lose weight, right? Or if I went to the gym and I was working my biceps and I did that maybe, 2, 3 times a month, I'm going to get some strength in the bicep, but if I stop, it goes away. So the point is that things are in a circuit together. And so a lot of times, by the time your child reaches school age and the teachers are the ones that are finding out that your child is having trouble reading, your child is having trouble paying attention, now we're headed in this new direction where the initial thing is, yes, we're going to get them some support, but by third grade, they are now going, we've got to help this child adapt rather than resolve. So my approach is about resolution because in most instances, if not all, you can get to the root cause of what is going on. Now, my pause in that for just a second is yes, some cases are much harder than others. And sometimes it is going to mean a longer program and really digging into, especially the chemistry, in order to figure out what other triggers are there. And the unfortunate part, I think, about what I do is lots of times people find me after they've already tried so many other things. And I think that's one of my hopes and desires with these podcasts that the information will get shared. The earlier you start, the better. You know, when I was got into practice, especially in the area that I am right now, meaning the physical area that I'm in right now in Atlanta, Georgia, I really wanted to do more lunch and learns for schools. And I had the opportunity to do a few before we got, the man-eating virus. And then, of course, everything just stopped. And one of my greatest desires is we should be a culture that is looking at the development of a child at ages 3 and 4, just from the academic arena, let alone that other people can do it before then. Also, helping young couples really learn what risk factors exist that are leading to greater developmental issues, because you can see it in the histories over and over and over again. There are known red flags. Most people do not know the state of health that they're in when they actually conceive a baby. In fact, I've asked every parent who has brought their child to me over 28 years, what was your state of health when you got pregnant? Well, I felt fine. The feeling part is just not enough in order to really know what's going on. I can tell you right now, people with known food sensitivities, known gut issues, known autoimmune issues, known higher stress level, maybe even to the point of being called anxious, definitely on any kind of pharmaceutical medication, being alone, gross discord in your life. These are all red flags that if this happens during your pregnancy, it does have an impact on your baby. And you know what, we'll do a podcast specifically on that, because really what I want to talk about today is to understand how far reaching everything goes. And one of the most common things that show up in my office are things that will demonstrate developmental issues and stress. Okay. And we've got to understand how those developmental issues then play a part into how the brain is going to begin to interpret its environment as a newborn baby. And then when things are not going the way that they should, that baby can also be in stress. No matter how much you take care of your baby, there's still their own innate physiological reaction. And this is when I find those primitive reflexes are not integrating as expected, and they are constantly tripping up the development of the baby. Remember, the primitive reflexes are the ones that literally begin the firing and wiring together in the womb. They are part of the birth process. We're going to talk a little bit about that today. And then they are meant to finish their job, and they have different times of finishing up their work. And the one that we're going to talk about today, tonic labyrinthine reflex, has two parts, flexion and extension. And the extension component is facilitated, activated, put into motion during a typical vaginal delivery. And we're gonna highlight that point today. So TLR for short, tonic labyrinthine TLR, 2 parts, flexion and extension. Little babies in the womb are in that flexion. And then this beautiful process of birth. And there's so many pieces that go on with the birth process. And the birth process really begins around 7.5 months when that baby literally turns. So the baby's head is upright, and that is to ensure that gravity is causing the bones of the skull to ossify or to harden. Then the baby turns around 7.5 months, and now the pelvis is upward, and the same process of ossification or maturation of the bones. Now that baby is going to begin to descend, and the baby is in flexion. One of the most important parts of this time is the molding of the cranial vault. This is so important because what's happening is it's putting what I like to call the big squeeze on the brain. And this is why, outside of an emergency, let's keep it over there, but you want to do everything you can to have a non-induced vaginal delivery, because just like I'm saying about everything else, we are beautifully knitted together, and every part of our existence plays a part in wiring us up. So as that baby is descending, that cranial vault is beginning to literally fold onto itself. So for the podcast audience, I got my hands on my head, and let's say I'm talking about the bones on the top of the skull, and they're literally going to fold over each other. And then the back of the brain, that bone back there, it's called the occiput, at your visual cortex, is literally in 4 pieces. And they literally tuck under and fold onto themselves. Now, there's also some really cool cranial nerves between those 4 plates or 4 bones, primarily on the outside to the inside before the brain stem. And then we have the inside to the outside, but that's 9, 10, and 11. And the big one there is 10, which is vagus. And so many things to irritate little babies have to do with that vagus nerve. And so here, even at Connect My Brain, I'm also a chiropractor. I do cranial work, and releasing the tension between those 2 little areas can literally calm down that vagus nerve, which literally infiltrates to every part of the body. And what it manifests as a newborn is colic. So that is a vagal irritation, and getting that released can allow that baby to start to get calm. Can you imagine being a newborn? And how they describe colic is that the baby's usually going to cry for about 3 hours a day. Imagine feedback. What do you think that's doing? Setting up that pattern that young. That pattern can get established very, very quickly. We have to know that children, babies, everything about them in the beginning is to learn how to be in their environment. And they're seeking, and they're engaging, and they're touching, and they're feeling, because they've just come from the aqueous world, the world full of amniotic fluid, where everything was duller, into a world where everything is on and bright. So the response time is going to be so much faster for whatever it is that they continue to go to is going to lay down a pattern. Okay, so back to our birth process, talking about how the skull, the head literally folds down. Now, this is so important because I call it the big squeeze on the brain. And what it's doing is it's literally sending feedback to the baby. You're getting ready to go to the outside world. Now, in a previous podcast, we talked about once that head is out, it's like a springboard, but now we got to get the shoulders through, and that's ATNR. So make sure you go back and listen to that particular podcast because you'll see how far reaching that reflex is. Now we are going to go through the rest of the canal, and literally the baby is face down. The pubic bone is riding along the baby's spine, and it's literally drawing up the little knees. And babies are going to urinate right there. They're getting out the byproduct of pregnancy. And then we all know that they have the notorious first bowel movement like you never see again. But now we approach TLR because the baby is going to toe off into extension. So paint the picture. I'm in the womb. I'm completely flexed. That's TLR flexion. Now, as that baby is going to come out of the birth canal, the extension is being laid down the second side of tonic labyrinthine. And what did I say? They toe off. So if you notice your child walking on their toes, there is a very high probability that they are stuck in a reflex that has not integrated yet. Now, this is a big one because TLR extension is not due to inhibit until about 3 years old. So it's a way to literally create counterbalance so that they're learning how to weight shift. And if they ever do feel like they're about to fall, they can change their body position. But it's not just about balance. Let's also remember that whatever fires together wires together. So what else is going on during this time? Well, TLR flexion will not inhibit until around 4 months. That's also the same time that the Moro reflex is meant to be completely inhibited. Now remember, Moro, go back and listen to that podcast because this is the one I always call the enchilada because it is arousal, CO2O2 reflex, and the sympathetic nervous system, fight or flight. So anything that's going on that's generating fight or flight in that baby is getting connected. What else is maturing at this time? A host of things. The eyes are quickly maturing to more adult-like within the first 10 weeks of life. Your immune system is the first 3 years, just like TLR extension. Your gut is by age 2. There's a host of things that are maturing during a very simple time of when one little reflex is trying to promote gravitational security in the world. Okay, let's back up again because I really want you to get this. TLR, when it's tested on a more mature child or even a baby, you're going to take the head. Okay, put a little star by what I just said. The head controls the body movement. So the head when it crosses the horizontal midline of the front of the belly, so going towards the belly button, the whole body, head, torso, legs, will come into flexion. When the head crosses the horizontal midline of the spine, the body will go into extension, just like we were describing being birthed by extension. I find it so interesting that I will be testing different physical movements on the kids, in particular, the dead bug move. And the dead bug move, you're laying on your back and your arms and legs are up in the air. And then you're going to go into a cross crawl pattern. So you can literally see TLR firing, because the child, as soon as they lay on their back and they pick up their legs, their bottom actually leaves the floor, their head comes up, and they actually look like they're in a pike position. That is how automatic these reflexes are. Just like with ATNR, when I go to get a writing sample, if that child turns its head and that reflex is still firing, the arm and leg on that side of where the head is turning will innately want to go out. And they will have to change their posture in order to accommodate a really far arm. And they do. They hold up their head. They may lay their head down on the table in order to write. So again, you don't hear the child going, hey, every time I want to write, my arm, it's just so far away. I got to literally pull my head towards it so that I can actually make contact with the paper. And this TLR is the same way. They may be in a flex position by sitting on their knees on their chair, or they could be completely laid out like little lowrider in a car. So you can see this even as it relates to posture. But TLR is dramatically connected to that Moro reflex. And this is why you have to be careful where you go for reflex integration work. In fact, I have now placed on my eSchool, which you can access from the website connectmybrain.com, there is a link for you to be able to work directly with me on reflex integration no matter where you are. It is now so well known that people are finding people like me who do this type of work. You got to be careful, because some people, when they go to do reflex integration work, they call it reflex integration work, but they only work on ones that they see. They may not really have been completely educated in this arena in order to understand that some of them absolutely will always fire together, and you must do both of them. So TLR, tonic labyrinthine, is highly connected to Moro. And so that's one of the reasons why, for me, I also like doing a stress response test. Remember, Moro, sympathetic nervous system. And we can actually quantify if an individual is in a chronic stress pattern. And this is a way for us to substantiate if that child, regardless of their age, even if they have learned many ways to kind of find a way to deal with their world so nobody really knows what's going on, or they're so tired of everything they got to struggle with, they just don't want to deal with it anymore, or They have figured out what you want them to say, and so they just say it so that they can move along. Kids are very intelligent, but this is such an important part to make sure that we know if these patterns exist. So let me explain how far reaching TLR actually is. Okay. So TLR, flexion extension, its midpoint or its movement point is the center of gravity. It's your torso. So this is how you are literally anchored to planet Earth. Okay. So if you have a problem or a reflex that has not integrated, you typically have issues dealing with space. You may not be sure of where you are in space. Kids that avoid anything that's going to make that surface unstable, like a bicycle, or avoiding sports, anything that's going to make them move quick, that's going to make them feel uneasy. They could have issues with distance and depth and speed. Now, especially, well, velocity too, but this also has to do then how your eyes are interpreting your world, your proprioceptive mind's eye, because that information is coming back in and it's now going to the back of the brain and projecting forward and also to the parietal lobes. And it's going to begin to impact how they learn. So when the astronauts would go to space, especially early on when they wore the white suits, NASA learned a lot on the earlier flights. When the astronaut was brought out of brought out of gravity, meaning up in space, it impacted their writing skills. They wrote from right to left versus left to right. They had trouble reading. And this was one of the things that they learned from the flights that began to change how the astronauts were going to be treated when they were up there, and why they started doing all kinds of exercises while they were up there. You know, the earlier days of the Apollo flights really reminds me of that movie WALL-E, because in WALL-E, we had destroyed the earth and we're living up in space, but people's bodies just got very inflamed. Their bone mass shrunk, and all they could do was ride around in a reclining chair. And all they could break down was a liquid diet. Well, early on in our Apollo flights, when the astronauts came back, we actually did not see them because they were grossly inflamed. We saw a picture of them and we heard their voice, but we did not see them because it would probably be interpreted, what are we doing to these people? But then NASA would do so much vestibular work on them. The vestibular system is inside of your ears. It's 3 canals. And I'm going to hold up my hand and demonstrate the 3 canals. So we've got an anterior, a posterior, and a horizontal. So for my podcast audience, I'm holding up 3 fingers. My thumb is going up, my index finger's going forward, and my middle finger's going side to side. And if I just follow the way the fingers are pointing, it helps you kind of understand how these canals actually interpret our world. So they're getting all of this information. And this is a mechanism of recalibrating an individual back to gravity. Babies are magnificent with this as they learn new little motor skills. They'll literally turn their heads, and man, they can just get their heads to where their chins are all the way up to the ceiling, and they're tilting those canals because they're taking their new little movements and they're calibrating them in to their body. It's a very important part of development. So when we see children with balance issue, proprioceptive issues, we want to automatically think, how? How is this impacting their eyes and their ears? Because all three of these systems, the vestibular system, your ocular motor system, your auditory system, are wired together and they are on the same circuit, wiring together, firing together. We always want to remember that. And when you have that, if one system is off, the other system is off. And early on, I saw this so much with children, and I used to just do so much vestibular work, so much ear work, so much eye work, but I never got anything else done. And in fact, back in 2012, with the help of a fabulous man, Dr. Larry Schultz, who created this amazing vestibular bed for me, and we put a visual piece and an auditory piece together, and now we give it high intensity and frequency to help those three systems get reacquainted as quickly as possible because they're foundational pieces. You know, you can work on the system from top down and bottom up. But when you're so close to the beginning of life, that bottom up approach is imperative so that you can get the foundation right, so that you can get it integrated, so that you can get this child moving forward on their own as fast as possible. That's always the way that I look at this. So the thing that these circuits can also help us understand is this idea of if you're hammering tutoring with your child and they still have retained primitive reflexes, which would cause their eyes not to work correctly. And this is not visual acuity. Visual acuity is like me wearing my glasses. This is ocular motor. This is about the 6 muscles that wrap around the eyeball. And we have a piece of diagnostic equipment here that is incredible in looking at and interpreting how that individual's eyes are moving. And we can even do a reading assessment with your child and watch how their eyes are moving along a line of print. So if you're going at this from the top down, that's really what tutoring would be. And we don't have the bottom up. It's that same thing we started with. I'm going to the gym, working my bicep, but I'm only going to do it like once a week. As long as I do it, I'm okay. But once I stop, I didn't really gain anything. So you've got to get to the root and you got to fix it. I got to go to the gym and have a set program, and I got to work that program. I've got to create the diet that every day is going to be the interpretation of what I want to do with my body composition. You can't just throw something in every now and then and expect change that's going to stick. But when you get to the root, it absolutely will be. This particular reflex is also highly important in if it stayed integrated, especially with flexion, it would have interrupted crawling and creeping. Okay, so we crawl on our belly and we creep on our hands and knees. And we need typical patterns. We need hands and knees, not hands and feet and not bottoms. We're not scooters. We're not laying on our hands and our toes to move around. All of the movement patterns are so important in bringing that brain online and telling people it's not important to crawl. telling people that we're now just going to shift all the delays or shift all the developmental milestones is absolutely harming our children. There is a developmental milestone sheet over on my website, connectmybrain.com. If you go over to the podcast tab, click on one of the podcasts over to the right-hand side, you'll see it says Dr. Laura Hanson's Guide to Developmental Milestones. Now, every single one of them is not there, but it's done in a way to get you started. And then if you've got any questions, you just got to reach out. Okay. You can send me a message through the website. You can call the office 678-501-5172. If we're with patients, leave a message. I assure you we will call you back. If you send me a note or leave a message, tell me when you're available so that we can really cut down on the back and forth. Let me give you a summary. If the TLR is still firing, what can it potentially look like outside of walking on your toes? See, what's going on if I'm walking on my toes is that if I put my heels down, I'm afraid I'm going to fall backwards. And so that startle, again, from Moro, fight or flight, is getting linked together with gravitational security. Okay, here's some others. Poor posture, muscle tone. Oh, see this so much, almost to where when the child's maybe their legs are turned in, turned out, elbows are turned in, they're just not standing up straight in gravity, poor sense of balance, probably getting sick in the car, oculomotor dysfunction, visual perception difficulties, spatial problems, poor sequencing skills, poor sense of time, poor posture, poor balance, same kind of thing even on the extension, poor organizational skills. Did you ever think that a reflex could be part of why your child's struggling to stay organized? I really encourage you, if you notice any of these things, a developmental assessment can answer those questions. You know, we got a few spots left. This is why during this time of early, end of the school year, early summer, I'm really trying to reach the community. This is a golden opportunity to work with your child. It's a snapshot in time. I know we want to go to the pool, we want to go to the beach, we want to do this. Not like you can't travel, but you could spend an enormous amount of time this summer and let your child get integrated and let them go back and have a dazzling beginning for their next school year. We hope that you'll reach out. Again, our phone number is 678-501-5172. The website is connectmybrain.com. Go over to the podcast and get that developmental milestone sheet. Just put in your information. We send it right to you, complimentary. And as always, I really appreciate my podcast manager. She's got me on a roll now, a great schedule, and we're looking to do some new exciting things. So stay tuned and learn what we're going to do. I can't wait. Thanks, Marcy. I hope all of you have a wonderful day. Be blessed, and thanks for tuning in.